Thank you for your statement, Cabinet Secretary. I would also like to place on record my thanks to Dr Ruth Hussey and the panel for the excellent work they've undertaken, for their report and their recommendations. The report starkly lays out in black and white the actions we need to take if we are to deliver sustainable health and care now and in the future. Dr Hussey and her team have done their job admirably. It's now up to us to do ours. We know the challenges, and the Parliamentary review have outlined the direction of travel. So therefore, we have to deliver the necessary changes. It won't be easy, as change is never easy. But we can't continue to deliver NHS services in the same way as we did 70 years ago. We all acknowledge the need for change. It is the task of each and every one of us here in this chamber to have an adult conversation with our constituents on the need for change, to push forward the principles of prudent healthcare and to support clinically led changes to services. Cabinet Secretary, it is your job to ensure that the necessary changes are actually delivered on the ground. The need for change is clear, and the NHS cannot afford to wait 5, 10, 15 years for these changes to come on stream. The NHS and social care need to adapt now if we are to have any chance of meeting future demand for the services. Cabinet Secretary, investment in staff is one of the biggest challenges facing us, particularly if we are to focus on local care delivery. Do you have any plans to increase the primary care workforce, particularly the number of GP training places in the immediate future? Digital technology will have a key role to play in future delivery plans. How do you plan to transform the way IT is delivered to the NHS? We have to ensure that the money we invest in our NHS is actually used to deliver these services. We therefore have to eliminate waste. And this week we have learned about the extraordinary level of fraud taking place with the European health insurance cards, with other EU citizens claiming free healthcare using fake EHIC cards, and today we learned of the level of damages and legal fees paid out by NHS Trust for negligence over the last 5 years. Cabinet Secretary, what is your government doing to eliminate fraud in our NHS and to reduce the level of medical negligence? I look forward to your new long-term plan for health and social care and working with you to deliver an NHS that is fit for the future.
Cabinet Secretary.
I thank the member for most of what she said. There were some points where we'd have to part company on agreement. I don't actually think that fraud related to the European Union and EHIC cards is a big issue that will undermine the future of the service. The challenge that we face in both need and demand, in having a rising and ageing population, in the challenges over money, I do not think are ones where we could say that European citizens, whether legitimately or otherwise, are going to undermine the future of the service. And it's not covered in the report. It's not got a significant area of interest. But of course, I would not want the service to be taken advantage of. There's a difference about saying I don't mind people come and do what they like, and saying that that's the biggest challenge we face. So I expect them to play by the rules. Where people don't, I expect the appropriate action to be taken. On your point about medical negligence, well, this is a constant challenge for any and every health service. And actually the response is how we improve the quality of care that is delivered, how that improvement action is a real part of what the service does and not just a fig leaf. That's why we need to look again at our own improvement programmes. 1,000 Lives has done significant work in improving the quality of care and decision-making across the health service. We need to look again at that as an improvement programme. The challenge the report sets us, and the quadruple aim, and look at delivering greater value. So those are things that we absolutely do need to do. In terms of your point about transforming IT delivery, I think it's been covered in other comments and questions. It's a key challenge for the health and care system, how we take greater advantage of what technology allows us to do and actually catch up with the way citizens currently live their lives. And your final point about increasing the primary care workforce. We are in a better place than other parts of the UK in some ways, because we've actually met our numbers and we've overfilled the places we had on the GP training numbers that you mentioned specifically. The challenge now is to understand what more do we need. And that isn't just a question for the government, it's also part of the reason we set up Health Education Improvement Wales to try and give that broader-based understanding of planning for a future workforce, making sure we have the places available, and then the difficult choices about money. Because if I had the opportunity and ability to, I would invest more money in the future of the health and care workforce, but I have to live within the means that this Assembly votes for me to be able to do that in the budget that this place will, I hope, to choose to pass later on today. So funding is always a challenge, but we cannot avoid the reality that we need to deliver greater value from the resource we put into our whole system.